one and all. Good afternoon. Today, on October 1st, we observe World Urticaria Day, the global awareness day for patients suffering from urticaria. In our previous episode, Professor Marcus Maurer educated us about urticaria and about World Urticaria Day. In our episode for the day, we will be discussing chronic urticaria in Indian perspective. So today we have a very special guest addressing the concerns of chronic urticaria patients facing in India. We have with us Dr. Kiran Godse. He is a professor at Dr. D.Y. Patil Hospital in Navi, Mumbai, which is a global allergy and asthma European network certified U-Care Articularia Clinic in India. He is also the president of IADVL, one of the largest associations of dermatologists in the world. Dr. Godse will shed light about urticaria today in our talk show. I am Kamal Narayan, CEO of ISW Council, India's premier institution for health advocacy, awareness, and behavior change. I am going to be your host for today, and I look forward to learning more about urticaria through this interaction. Today's webinar will bring to light the symptoms, management, and treatment of urticaria. We will also talk about how it affects the quality of life of the patients. But before I start, I would request our online viewers to share their questions on the comment box of this show. We will be trying to get them answered during this show from Dr. Godse. Also, do like and share this live program on your wall so that your friends and followers too can get benefited from this information. So let me begin this show without any further delay. First of all, welcome again, Dr. Kiran Godse, for this special show. And let me begin this show by asking you to help us understand and our audience today that what is urticaria and what are its types, how it gets manifested in our body.
Yes,
Dr.
yes.
Godse.
Thank you, Kamalji. Well, warm welcome to all my viewers who are watching it. I'm happy that today is the Urticaria Day we are celebrating. This is the World Urticaria Day. The purpose is to raise awareness. And as you say, urticaria or hives or pitti or daffod, there are so many colloquial Indian terms to that. But typically hives or is the local term. What you get is a red bumps on the body, all over body, and it are severe scratching. These are red bumps and the causes are many. The urticaria is divided into acute and chronic. Acute is one which disappears in 4 to 6 weeks, and chronic which can go from 6 weeks till 10 years. So acute urticaria is what, if you go in the restaurant, had some seafood, start getting itching, you know that I'm not comfortable with that food, so you avoid that. Or if I take a painkiller tablet, I start getting hives. If I take an antibiotic, I get hives. So typically medicines can cause acute urticaria. Drugs or painkiller tablets can cause. Then the food like seafood or eggs or some of the colored foods can cause urticaria. So patient realizes that that is acute urticaria. And rarely infection. Now remember, during this COVID epidemic, the urticaria is one of the manifestation of a COVID. So patient coming with fever and hives or urticaria, they could be having COVID, but that is very small subset. Let me tell you, don't be afraid that if you got hives, you have got COVID. No, it is not that way. It is one of the rare symptoms. Other symptoms are different. So, but well, urticaria, for example, if you get a fever or measles or any other infection, viral infection, you can get hives on the body. So acute urticaria is easily treatable. Patient takes treatment, goes to tablet, take anti-allergy tablet and goes away. The problem is chronic urticaria, and that is our discussion main point is chronic urticaria staying with us from 6 weeks to long years. And this urticaria is most tough to treat. And these urticaria, the symptoms obviously are same. You get red, easy bumps on the body, swelling of the lips or swelling of the body, and this itching can be severe, and patient just doesn't know when he's getting itching, and he's more become panicky and frustrated that I can't speak, I can't talk, I am continuously scratching. So this is about acute and chronic.
So the itching is very, very intense in that.
Yes, yes. Intense. Just imagine I'm talking to you, I start itching severely. What will happen to me? Just imagine I'm talking and I get a swelling here. So that is
Okay.
the bad thing. People really hate that thing that I'm scratching, I'm presenting somebody, I'm talking and I'm scratching. So the itchy sensation is most tough to treat, and that is the main symptom of urticaria.
So you said that this chronic Urticaria, stays for 6 weeks or more than that. So is it in continuation to 6 weeks, or it is, you keep getting manifestation and then it disappears or comes back, something like this?
Typically, urticaria affects almost daily. So the patient keeps on getting hives daily or almost daily, and it can be there for weeks and months together. So that is the most troublesome part. And the appearance, the itching is could be daily, so that is most frustrating, and they keeps on getting hives at different places at different areas, and they come and go. Typically the hives disappear in 24 to 36 hours, but it is actually debilitating because patients are really frustrated, and it almost the 1% of the population of the world is suffering from urticaria. So you can understand the intensity. Almost 1% of the population, so India's huge population of 135 crores, 1% are big numbers, and we have got just 8 to 10,000 dermatologists to treat that.
So around 1 crore 35 lakh people would be having this problem in India.
Yes, yes, yes. So it is a huge number.
Dr. Godse, is it a dermatological problem, or is it a, some kind of immune problem? What is it? And as you are saying that it is not a specific part of your body where you see the, these hives or with these, or what you would like to tell about this to our viewers?
Yeah, so to tell you that this can affect almost any part of the body, and this is chronic urticaria. Now we know almost 30 to 40% is autoimmune in nature. So what we tell that तुम्हारा खून ही तुम्हारा दुश्मन है. What happens is on our own blood there are autoantibodies which actually keep on stimulating the mast cell, which trigger histamine and which causes urticaria. So autoimmunity plays a role and autoallergy plays a role in chronic urticaria. So these two are the main causes of urticaria, chronic urticaria, where autoimmunity and autoallergy are the play.
Okay, so autoimmunity means when your immune system become little adverse to yourself. And what is autoallergy, sir? For the
Yeah, autoallergy is a new concept. Basically, there are multiple allergens. So this is a anti-allergen antibodies are made in our blood, which causes urticaria. So typical allergen like if I get in contact with some chemical, I start getting itching. So it's an allergen. This is a autoallergen. What it means is allergy within itself is known as autoallergy. So which can also be a cause of chronic urticaria.
when it comes to these hives or bumps on body, we have a different kind of names, as you mentioned, many of them in multiple languages, and different community use different names. There are a lot of myths also around them. What are those myths, and how we should deal with that?
Yeah. So typically, once the urticaria, chronic urticaria, if a patient keeps on suffering, then he keeps trying to search. Somebody said, don't eat that, don't eat curd, don't eat this, don't eat food, don't eat besan, don't eat brinjal. There are so many things that these food can cause urticaria. So patient keeps on trying to see if I avoid this, if I get urticaria, if I eat this, if I get urticaria. So there are many myths that food is the cause. Remember, in chronic urticaria, food is rarely a cause of chronic urticaria. What happens here is maximum is the colored foods, orange, red, Chinese, preservatives, dyes, and chemicals can cause urticaria. But the true food, what you eat day to day in your home, is less likely to be a cause of chronic urticaria. And many times patient keeps on changing, finding out that if I don't eat gluten, I'll get it. If I don't eat wheat, I get it. But it is not so. So remember, for chronic urticaria, food is rarely the cause. So we tell the patient that don't concentrate on food. You eat your daily home food, and outside canned food, red, Chinese, orange, these food you should avoid. So that is one myth people often think. Other myth, patient think that urticaria, once it occurs, this or cancer or something like that. No, remember, urticaria only affects the skin. It doesn't involve inside. Rarely it can go in the larynx and cause choking sensation, but typically what you get is maximum is the allergy on the body. So it has got nothing to do with inside. But yes, those patients who have got thyroid, hypothyroidism, almost urticaria is more common in those patients having thyroid abnormality. So all the patients we advise them to check thyroid, because thyroid and urticaria has the relation. Otherwise, food, well, please avoid few things what I told you, but it is not the myths. Is often people keeps on searching for the cause, and then people has got think that if I ate the kadas or something, I'll get cure of urticaria or some herbal preparations. Well, it is not like that. This is an allergy due to histamine, and you need to take an antihistamine tablet or an anti-allergy tablet to control. So most of the time, patient keeps on trying all these food changes and diet changes or eating. That is the wrong thing. So don't think that food is the only the cause of urticaria.
So when people actually experiment by curtailing some food, adding some food, or stopping some food, when they see these kind of manifestations of let's say urticaria, it also delays the treatment because you are not actually seeking the treatment. So what
Exactly.
kind of damage it can cause if we keep delaying it by doing our own home remedy or self care?
Yeah. So important is for this urticaria that simple treatment is anti-allergy tablets. But patient keeps on changing, stopping medicine, stopping food, adding something else, and seeing. And many times it is not diagnosed. Patient often think that this is something else. Unless he come to a skin specialist or a dermatologist who are trained to see that, they'll tell you, look, this is urticaria or hives, and the treatment is as described. So many times, almost 2 to 4 weeks, patient will ask the chemist or the colleagues or friends and try some herbal remedies or something which is advertised in the product that you try this, it will go away. And almost 2 to 4 weeks are wasted, and then he realizes that where I have to go to a skin specialist who can diagnose it and treat it and tell you how long the urticaria is and the treatment. So often patient comes to us little late.
So once, let's say, these patients come to the doctor, what are the ways to manage urticaria? What is the typical treatment line which doctors suggest on urticaria, and how long it goes?
Yes, yes. So when patient comes to us with chronic urticaria, we try to assess the symptoms. We do some simple tests like scratch test or dermography meter or some simple blood test, just a CBC, sugar, thyroid, urine, stool, just to find out that everything is okay. He's not diabetic, he's not thyroid. But we don't do heavy allergy tests, like prick test or the long 10,000 rupees allergy test. We don't do that. We assess the situation, how bad is urticaria, and then we see the first treatment is a non-sedating antihistaminics. These are the modern antihistaminics which are very safe. They can be taken continuously from weeks to months to years, and they will not give you any sedation. We have got the best of best antihistaminics which will not give you sleepiness. Many times people think that if I take anti-allergy medicine, I'll get sleepy, I'll not able to work. That is old anti-allergics. But now newer anti-allergics which we have got, they are very safe and can be taken continuously and does not cause any major side effects. So that is
So,
important.
so the treatment takes a little longer because it requires, I think, a longer management
Yeah,
to.
yeah. So first we investigate and we start the treatment. Now, typically when I start the treatment, anti-allergy tablets, one tablet twice a day, patient is very happy that everything is gone. And then he says, there is no need to go to doctor because everything is gone. I forgot. Then after 2 to 4 weeks, he forgets the treatment and he again gets hives. So
So compliance to the treatment is very important. Otherwise, it can even get worse as we go along.
yes, yes, it's important because if treatment is continuous and long term, it is not that 2 weeks of treatment and my urticaria will go. Remember, if you have got urticaria of 2 months, 3 months, 6 months duration, it cannot go in 2 weeks treatment. So please understand that anti-allergy tablet, doctor will decide how much to give. We can give one tablet, two, or even the four tablets of urticaria anti-allergy tablets, and it is safe, which can control the disease. But many times patient just forgets the taking tablet. He thinks that is not required, or he thinks that there could be side effects, and that because of fear he stops the tablets. So that is important. The compliance is an issue because this is a long treatment. It is a months and years. That is what it requires to control the urticaria.
Dr. Godse, I would also like to understand from you about this International Articaria Day. But before that, we are getting some questions from our viewers who are watching it live. And one question is interesting, that can urticaria come back after a gap of 12 to 15 years?
Yes, yes, exactly. A good question. Yes, it can, theoretically, it can come. Remember, when you come gets urticaria, it can stay from on an average 1 to 5 years or 7 years. It will disappear. Well, again, after 5 to 10 years, he or she may get urticaria again. And again, you need to take treatment typically for 1 to 3 years or 5 years. So it is possible to come, but obviously not in all the patients. Typically, we see that only 10 to 20% patients may get a recurrence. Otherwise, others get a long remission.
Okay, so there is one question. I think you have already answered that, but if just for the sake of the viewer to understand it again, is urticaria associated with hyperthyroidism, which you have already mentioned? So please, if you would like to again highlight on this point, sir.
Now remember, the thyroid is one of the commonest. Hypothyroidism is more common, not the hyper. And remember, urticaria affects 2 times more common in females than in males. And typically from 20 to 50 years is the maximum, and most of the time people get urticaria. And in women, those who have got thyroid, that is almost, we say in Mumbai, 30% of females may have hypothyroidism. So there is a relation between thyroid and urticaria. So we expect that if patient has a thyroid, they must take treatment. And obviously, the thyroid treatment is also continuous and lifetime. And if it is not controlled, the thyroid is not controlled, the urticaria can worsen. So that is the relation.
One more question is, as you see that there are multiple way of, or remedies which are, people try to experiment. There is one question asking about that, will homeopathy treatment help in urticaria? What are your take on it?
Yeah, remember, people often go to homeopathy thinking that it is safe and it will control the disease. Well, there could be some disease medicines which are effective. I have no experience, but what I can tell you that my modern medicines, which are allopathic medicines, for which we are trained, we know that they are safe. These are not some steroids or some strong drugs. These are plain anti-allergic tablets, which are almost like a OTC, over the counter in European or foreign countries, which are safe, and they can definitely give a long relief. So obviously, it is not that homeopathy is better, because the science we know, that anti-allergic tablets we know. So our treatment is definitely better than any other.
What is the role of stress in urticaria, or maybe either its progression or its worsening of this disease?
Yeah, stress, anxiety, and depression all are related, because due to stress and anxiety, if I start scratching, my urticaria will worsen. So obviously, stress will worsen the disease, and many times people during COVID has got too much of stress. So we see more urticaria patient now, because the stress of sitting alone at home or not having job or the losing the money, all the stress is shown on the skin, and many times the urticaria worsens. So what was well controlled disease earlier has become ill-controlled disease, and then they come to us. Obviously, at first 2 months, it was very difficult to connect the doctor, but now the teleconsultation is available for. It is legal in India also, so that they can connect. But yes, the stress is one of the common factors, especially during these turbulent times.
And it is easy to kind of diagnose or understand that this is urticaria during teleconsultations also, because people are kind of normally what we are seeing, that because of COVID-19 people are not going to the hospitals or clinics even for something much more severe or serious. So I think hives maybe come in the last in the priority. So how the effective the teleconsultation is for
Yeah.
this particular disease?
Typically, if a good quality photo from a mobile, we can able to diagnose the disease, and asking few questions, and think we are able to diagnose. Obviously, there are some areas where we found that it could be something else. We always tell the patient to visit the clinic and check. But otherwise, on a photograph, typically a dermatologist can diagnose hives, and then they takes the history and gives the treatment.
And another question from our live users only viewers, uh, is urticaria cured forever if we go for a compliant treatment for a certain period? Is it cured forever?
Yeah. Now remember, urticaria is more of an autoimmune disease. Typically, on an average, in 1 to 5 years, most of the urticaria gets good long remission. I'll not say cure, but we get a long remission which can last for few to several years. And most of the patients do get a good cure, obviously, but we cannot predict who will be free of the disease at the end of 2 years or 5 years or 7 years. But yes, it will give, our treatment does give a long remission and good control of disease.
Wonderful. So, Dr. Godse, let's talk a little bit about National Articularia Day. What is the significance of this day, and especially for India?
Yeah, as you know, urticaria is a disease which first was neglected. First, people never used to think of it, but now we know that it affects 1% of the population. So this Urticaria Day was devised from the German Gallen Allergy Society, Global Allergy Society, to raise the awareness. Basically, we have to tell the people and the patients, everybody, that urticaria is a disease which can stay for months to years together, and we have got a very effective treatment which is available with us, which you need to take regularly as prescribed by a doctor, and treatment is continuous. And if your antihistaminics do not work, we have got a few stronger medicines like immunosuppressants and biologics, which are the new medicines nowadays. They are also available to us. So there are wide variety of medicines which are available to treat the disease. So this purpose is to raise the awareness all over the world.
What is the level of awareness in India as per your estimation?
It is really a low level, because most of the time now with mobile people do search and they go to this thing, but obviously the correct information is still missing and awareness is still not as expected. So many times patient thinks that something will happen, my urticaria will go, they'll try home remedies, try the remedies. So awareness, obviously we need more programs like such to raise the awareness.
It's also possible when you go search about hives and maybe repeated hives, you get to see more about, let's say, autoimmune diseases, rheumatoid diseases, lupus, and all those kind of things also. So, how much information people should rely on, internet sources and all, or when they see this kind of manifestation, the first thing should be to, either consult a dermatologist or call up a dermatologist in today's time.
Right. So there are website. Obviously, the Google can be tricky itself, but go to official website of a medical association like urticaria.net by our Global Gallen Society, which is a reliable one. So go for the information from the big association like IDL. Our association will also has this patient education pamphlets available on our website. So go for thing. Don't go for the things where many times it is the purpose is something different, not the education, but just to selling their drugs. So that is important. The patient has to go to right website for the good information.
How much this problem of GERD or acid reflux, is it also related to, or does it lead to something like urticaria? There is a question from
Right.
audience.
Now, actually, what you say as pitti, that is acidity in the stomach, there is indirect relation with the thing. So that is acidity in the stomach or the pitti, and this is a pitti on the hand. So many times patients do complain of acidity, gastritis, and then they get worsening of hives. So many times we give not only non-sedating H1 antihistaminics, but we also give H2 antihistaminics, which controls the acid reflux or gastritis. So if patient has got this complaint like gastritis, acidity, they might feel the worsening of hives. So we give a combination treatment, which is known as H1 plus H2, that is antihistaminics and to reduce the gastric irritation, H2 anti. So we do give. So obviously, few people have this combination of both.
So you mentioned about this International Articularia Day. So what is, is there a special theme this year for Articularia? Is there a specific focus? Normally these health days have some specific focus every year.
Right,
so what is the focus this time or for Articularia?
This time the focus is what our theme is, we care at you care. What it means is we care is dermatologists care about the disease, and you care are the Urticaria Center of Excellence. Urticaria Center of Excellence are known as you care centers, which are there all over Europe or India, Asia also. So where we have got a center of excellence where we give the best treatment to the Urticaria patients, and we have fortunately in Navi Mumbai at Patil Hospital and PGI Chandigarh in North. These are the two centers where we have got a Urticaria Center of Excellence.
So how these center of excellence are working in spreading more awareness? Your DY Patil hospital and also the PGI, are they also kind of doing some kind of community engagement? What are the ways to reach out to the people apart from what we are trying to do?
Right, right. We do give treatment on urticaria. We have got a special day on urticaria clinic where patients of early urticaria come to us. We give them treatment, advice, and we have a group of the people affected for their social awareness or a support group, which is also there in our hospital. So where urticaria patients talk with each other and understand the disease, and many times they realize. And being a UK center, the best of best treatment and the newer biologics which are being introduced, we also have we can try these new molecules with the patients so that we know how well it works, and there's an advantage. So they get the complete treatment of urticaria at this center of excellence.
What are the apart from, so you said food is something which is not the trigger for something like urticaria, and so what are the other causes can be possibly? Is physical exertion it's something, weather change is something which can cause, uh, or these are also not an important aspect?
Right, right. There are something known as a physical urticaria or inducible urticaria, where the cause is in the environment. Something, if I go in sunlight, I start scratching. That is sunlight induced urticaria. Then, if there is a cold, extreme cold, if I go to cooler climate, I start getting itching. That is a cold urticaria. Vibration urticaria, extensive vibration instrument I take, I get urticaria. If I sweat profusely, I get urticaria. So all these urticaria are known as physical urticaria, where patient understand that if I do this activity, I get the disease. So typically sunlight, extremes of temperature like heat, cold, vibration, and the pressure, delayed pressure. If I hold something for very long in a hand, I start getting swelling of the hand. So these are known as physical urticaria, which affects almost the 1/3 of chronic urticaria is physical urticaria. So where treatment is same antihistaminics, but some they need to understand that they have to avoid sunlight or avoid extremes of temperature, few physical changes in their body or quality of life or the regular lifestyle that helps them. So physical urticaria is one entity which involves 1/3 of the chronic urticaria patients.
Dr. Godse, you are a IADVL president and very senior dermatologist in the country. Uh, how do you see the role of all dermatologists in spreading awareness about urticaria and also about the effective diagnosis and treatment of this particular disease? What is your message for your fellow dermatologists also?
Yeah, yeah. So on this year, Urticaria Day will be celebrated by IID Association officially. So all the states presidents and all the state dermatologists, we send them patient education leaflets which they can distribute to the patients. We create posters for raising awareness, and as well as we give talks or the social media messages to raise the awareness. So all these activities are done by all the dermatologists, almost 8 to 10,000 in India, which helps to promote the awareness about urticaria. So this is a attempt which is slowly growing, and obviously with time we'll know that how good it impact has. But well, it is working well.
So, Dr. Godse, on 5 points we may like to, convey to our audience as a takeaway for today's session. Even if they have urticaria or if sometime, they get somebody or they, face this problem, how they should, kind of understand and how they should respond to this particular disease or a problem. So, some five points, if you may like to summarize it.
Yes, yes, yes. Well, thank you. Well, understand urticaria can affect 1% of the population. If you get red, itchy hives or bumps, please go to a skin specialist or a doctor who can treat the disease. Take the medicine regularly as prescribed. Most of the anti-allergy medicines are safe, can be taken continuously. Few minimum investigation you need to do. Don't go after allergy test or the prick test or any other test. The treatment remains anti-allergy tablets and sometimes immunosuppressants and biologics. Follow the doctor's advice continuously and take treatments. Typically, in 3 to 5 years, most of the urticaria goes into remission. But important is follow the doctor and take the treatment. Don't fall to prey into the somebody's telling that this is the cause or that is the cause. Please follow your doctor, and he's the best dermatologist, the best person who knows this is well.
Thank you so much, Dr. Godse, for summarizing it for our audience. And that the last point you made about I think allergy tests also. This is also important aspect. I think we keep going for one test to other test. So thank you so much for your time and for helping us spreading more awareness about Articularia on this special day, which is also International Day for Articularia awareness. And also thank you to our audience today for being such an enthusiastic and engaging audience. We got a lot of questions and we tried also to answer many of them. Definitely this was a very informative session, Dr. Godse. And the take which I can have from this session is that a disease or a condition like urticaria is may look simple to begin with, but require definitely a much more, I think, serious clinical intervention. So rather than going for self-diagnosing or self-treatment or trying to self-cure it, I think every one of us, we should definitely try to reach out to a specialist dermatologist to understand this disease. And also, even if you are living in a and trying to not go out because of the COVID-19 scenario around us. I think most of the doctors and even Dr. Godse would also be available in a lot of those teleconsultations. So most of the doctors are available. They are trying to help you, to the best of their capacity, even in these physical constraints. So with this, I think I hope all of us this session have helped us getting a better understanding of urticaria, and especially from Indian perspective. Thank you again, Dr. Kiran Godse, for taking out time and educating us on such an interesting and important topic. And thank you everyone for attending today's webinar. For those who have missed our previous episode, we are sharing the link in the comment box of today's program. For more information, you can visit Articularia, and it's for its management. You can visit allergyfree.co.in. Stay tuned and keep following our social media pages, Facebook, Instagram, and also Twitter for updates on various types of allergy management. This is from this allergyfree.co.in pages. There you will also find a lot of their social media handles there. You can get a lot of information, and for all that concerns to your health and well-being, do follow ISW Council pages and ISW Council's program to understand and to know more for what all concern your health. Thank you so much for your time today, and stay happy, stay healthy, stay safe, and stay at home as much as possible. Thank you.
Thank you. Thank you very much.